What is important thing for us? Actually, patients with lymphoma have higher incidence for development of thromboembolic events. What does it mean? It means that, for example, patients with lung or gastrointestinal cancers have a smaller incidence of thromboembolic complications, while patients with lymphoma have 10-fold higher incidence for development of thromboembolic complications. It is very important because thromboembolic complications are second reasons for death of cancer patients. In other words, adequate thromboprophylaxis can prolong survival of our patients. Because of that, 5 years ago, our team from Clinic for Hematology Clinical Center of Serbia from Belgrade developed Thrombosis Lymphoma score based on analysis of approximately 2,000 patients with different type of lymphomas. In that first group of our lymphoma patients, in our derivation cohort of patients, we definitely had only 20% of patients with Hodgkin lymphoma. But we also know that the biology of Hodgkin and non-Hodgkin lymphoma is quite different. And because of that, we decided to analyze homogeneous group of Hodgkin lymphoma patients in collaboration with German Hodgkin Study Group. We analyzed 5,500 patients with Hodgkin lymphoma that were treated in different clinical trials. In that analysis, we showed that thrombosis lymphoma score based on previous arterial or venous events, based on reduced mobility, based on body mass index, extranodal involvement, mediastinal involvement, development of anemia and neutropenia, is good predictor for development of thromboembolic complications in Hodgkin lymphoma patients. We have calibration that is adequate for our group of patients. It is approximately 0.57. It could be better, and because of that, we have a plan to extend our investigation in next years in order to improve that calibration of our score. But having in mind that we don't have any better risk assessment now, we think that thrombosis lymphoma score could be part of everyday clinical practice in clinics that deal with patients with hematological malignancy, actually with lymphomas. We have, of course, expectations from European Hematology Association meeting this year. I hope that some collaborators and some colleagues from different countries from Europe can enjoy us in some investigation and give us maybe patients in order to make external validation in a different group of Hodgkin lymphoma patients, because I have to mention that we analyzed patients from different clinical trials. We want to analyze patients from real world practice, and because of that, I would like to invite colleagues from other clinics to enjoy us in collaboration in assess of our thrombosis lymphoma score.